Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about, is the medical coding field saturated with too many coders right now? And is this a good career field for you? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this message and I feel like all these episodes I'm just repeating myself, but let me repeat myself again. I'm going to read this and then we're going to get into it. So here we go. So the viewer says, "Hi Blue, I'm considering registering for a medical coding training program. Before I make a decision about doing so, I wanted to reach out to recruiters. Bad idea, because if you want to be sold a product, you by all means go right ahead. Contact a recruiter, okay? And other knowledgeable individuals in the field to ask a few questions and hopefully receive the answers that might help me make my decision. And I will also say this before I go on. I created this channel with the hope of sharing more about the industry and about the career field. I got plenty of episodes, 1,400 plus episodes on my channel where I talk about everything, everything. And so one of the things that I've always said is that it's not my job to convince you, okay? And sometimes I get messages like this from people and I feel like they want me to convince them to go into this career field. This career field is not for everybody. It's not. This career field takes a lot of study and a lot of patience and a lot of practice. And patience and practice is two things that a lot of people just don't have the patience for. They don't want to do that. It's too hard. And that's just baloney. You know, there's a whole other life on the other side of laziness, of not wanting to push yourself, of not, wanting to try new things. There's a whole nother life on the other side of that, okay? Not that everybody that, doesn't want to pursue this is lazy. It's just that if you are looking for something easy, is what I mean. If you're looking for something that's easy and that you just want to get in it right away and make all this money without putting in any effort, you are going to see your personal efforts not fulfilled. And that's where people get frustrated. First of all, I've read that the markets are highly saturated right now. I don't know where they're getting their information from, because if you look at the Department of Labor or the Bureau of Statistics, they do have articles where they talk about how the career field of medical coding and health information is going to be expanding in the future years. So again, where are we getting our biased information at? Okay. I'm about 2 semesters away from completing my bachelor's degree. Would having a bachelor's degree along with completing a medical coding program and becoming certified help me stand out above other applicants, specifically for entry-level positions where others also with little experience might be applying? I'll get into that in just one second. And then they asked me about a specific program, which is mid-level cheapy type of program, okay? There's cheap programs, right? And they they say, oh yes, we promise to get you through and we have a free credential that goes along with this program. And then you find out once you do all of that no one's asking for that cheapy certificate, okay? They're looking for 2 associations and they're looking for 1 of 4 credentials. Either the American Health Information Management Association or the American Academy of Professional Coders. The 4 credentials that they're looking for, all you need is 1, is the CCS, that is the gold standard of medical coding credentials, because it says you've mastered inpatient coding and outpatient coding. Then there's the CCA, that's a Certified Coding Associate, that says you have entry-level competence, that you know inpatient coding and outpatient coding. And I had that for 13 years, by the way. There's a CCSP, the Certified Coding Specialist Physician base. That's all outpatient coding, okay? And these are all with the American Health Information Management Association. Then there's the CPC. If you have no experience, you come in with the CPCA. That's a Certified Professional Coder Apprentice. And that is with AAPC. And you'll get hired having any one of these 4. You do not need multiple credentials, okay? Some schools would even tell you that you need to be certified through both associations in order to find your first job, which is garbage, because if you look at the job listings themselves, it'll tell you we are looking for 1 of these. So that's how, you have to make the decision to do your research first. And your research should start in looking at the job listings to see what it is that they're looking for in that area. What are they looking at as far as like education wise? Now, as far as this little cheapy program, I've always said I don't have relationships with any of these schools. I have had one horrible person try to get me to, oh, well, we'll pay you for your endorsement of our program. This was a crap program that was very fast. The materials that they had were just terrible. And I'm just like, no, absolutely not. If I don't know this product, if I don't know the teachers, if I don't know the school itself, I will not endorse any product that I don't personally know. Okay. And the person couldn't even tell me about the program itself and what were they offering. I had to do the research. And what I found, because that person is not a coder themselves, and so they don't really know or understand, they're just about the business side of technical training for adults. If you get into a program, it's their job to sell you that program because they need to get students in that program. And if they can sell you this dream, if they can sell you, hey, we can get you for just a few $100s, we can get you on the road to a high-paying career. You do this to enough people who are desperate and who want to have these wonderful careers where they can work remotely, where they can travel, where they can make these high amount of dollars, and you can sell that, then you've got a captive audience. And it doesn't matter, because once you have their money, whatever happens is their decision. Because learning medical billing and coding or medical coding is always going to be self-driven. Always. You can get into a good program. Maybe there's some out there. I've heard of a few. But again, I don't have personal relationships with these schools. So I will never be in a position where I'm going to sit here and hawk a school. Okay? Because that's not my purpose of being here. My purpose of being here is sharing what I love about this career field, answering some questions about the career field, because I've been in it for 17 years. So again, I'm very straightforward and blunt. A lot of people don't like that. They say, oh, it's so mean. There's so much sugarcoating nowadays. That's why you can't distinguish between when somebody is trying to tell you, hey, wait a second, versus somebody that's trying to take advantage of you and take your money. Let's think about this, folks, okay? I'm just saying. So no, I will not answer this question about this little cheapy program. But what I will say is this person says that they're about 2 semesters away from completing a bachelor's degree. I don't know what their bachelor's degree is in. They did not specify. But here's the thing. Whether you have a degree or whether you have no degree, you as a brand new medical coder are going to be in the same boat as other people who have no advanced education. You could come in and be a nurse, and this is what happens to my nurses too, because there's lots of schools out there that will target my nurses and build them up and gas them up and be, oh yes, you can do this. This is going to be a walk in the park. It's so easy for you. No, it's not. If doctors can't understand medical coding, they have a hard time understanding it themselves. What makes you think a nurse can understand it so easily? And my nurses get offended. I know, because I always get people thumbing down. I don't care. You thumb it down, guess what? YouTube still puts it out because it's engagement. So if you really want to punish me, don't watch. You know what I'm saying? But here's the thing. When you are trying to learn this and you're trying to get your foot in the door, if you cannot effectively put onto paper, because your resume is very important, if you cannot effectively put onto paper your transferable skills and what you learned in the school or what you learned on your own, no one will pick you up, because it looks like you don't know what you're talking about. And for my nurses, they love to talk about all the fact that they can do lines and they can do all this and everything involved with nursing, but nothing about like the documentation side. What did you do documentation wise? What did you do to make sure that everything was there, all the elements were there, so that way when it's being submitted to the coder that it was okay and that kind of thing. A lot of people miss out on that. So whether you have a degree, whether you have background in medical, or whether you have no background in medical, everybody is equal. And that's the weird thing about this career field, right? Because everybody starts off equal. Everybody does, okay? And even if, oh, well, no, because such and such has a friend and they were able to get in because of their friend. Relationships are very important and they are critical, but it's not the make or break, because I knew not a single person when I got into this industry either. Okay, I got my first job by going through a temp agency that I didn't even want to go through, but I had no other choice, no other option of like, okay, and the principal of the school said, here, if you go through and you get a job through the temp agency and they're able to get you an assignment, you have something to put onto your resume versus not having anything on your resume, which is what I was going through for the first 2 months, which I didn't have anything. They said, oh, your resume looks good. You passed our assessment test, our assessment test, but we still need you to have experience because that's what the requirements are at our facility, which I think is really stupid, especially if a person that's coming in that has a degree and is in leadership and has been there, done that. If you know what the struggles are for new coders coming in, why would you allow that to be at your facility? I'm just saying. So some of this is a little bit of coder on coder, coder on coder crime, you would call it, But the thing about it is, the only way that's going to change is if people actually start taking it seriously when they're getting out there, my new folks, because you would not believe the number of new folks that get out there and their school only taught them how to pass the certification exams so they could get that statistic, right? Oh yes, we have a 95% pass rate on our exams, blah blah blah. I've had people come up to me that, oh well, I have 100% pass rate because they were doing a prep program. I'm not gonna say for which credential. I have a 100% pass rate on my prep program. That's a lie. That's a lie. How do I know? Because I've gone through with people and tutored them. And as much as you can tutor somebody, you can have a high pass rate, yes, but 100% pass rate is impossible because there's always going to be somebody, no matter how hard you work with them, no matter how good they do with you in those tutoring sessions, that when they get to that room, they freeze. They freeze and they fail because they're in their own head and there's nothing that you can do about it. So for somebody to say, oh, I have 100% pass rate is a lie. And again, I'm not going to fall for that lie. Absolutely not, because again, you can have a high pass rate if you're tutoring people or if you're going through a program or making a program or whatever, but not 100% of them are going to pass. Not 100% of them are going to understand it. But again, a lot of these schools, they're going to teach you how to pass the certification exam, and then you're on your own. Well, then when you're out there, and sometimes they'll tell you, oh, well, you'll get trained on the job. I know, because I was told I would be trained on the job. But for me, just because of how I am, I know I want to understand the material myself. So that's why I made those efforts to really understand. So there's a difference between those that are just believing whatever they're told in the school, and then, oh yeah, they expect the employer to teach them. And then they're over there looking for an entry level position because they want somebody to sit here and hold them by the hand. Well, when you get your certification, the second you get your certification, this says you're competent. Why? Because it says that you've been tested on all of these domains. You've been tested. The bulk of these exams is on coding. So this says once you pass this exam, doesn't matter what your score was, you are competent in coding. And if you don't feel competent in coding, you need to go back through your workbooks and you need to work through them. You need to find ways of learning. If you have Optum books, Optum ICD-10 CM, and if you were learning ICD-10 PCS, if you have the Optum version of these two books, the Optum Expert for Physicians for the ICD-10 CM, you can go through those chapters. You can look at the beginning of the chapter and it will have examples for you. You can cover up the answers because it'll give you the example, the answer, and then the rationale. You can cover up the rationale and the answer, and then you can practice. And that's how you start learning through the book, through the entire book. Okay, and I've demonstrated this more than once on the channel already. Okay, but that's what you got to do. In the back of the Optum ICD-10 PCS book, the spiral bound book, it's not the flat edge book. Okay, don't get the flat edge book, get the spiral bound book. There's 388 ICD-10 PCS procedures, and you got to look up all of them. And so that's why you get your practice. And once you start getting that practice, that's when you'll start to get better, and that's when you'll start to get more confident, and that's when it's going to start making more sense. But if you're getting into this like this person, half doing your research, half not really doing your research because, well, I read. I don't care what you read. Are you looking at the job listings when it says that they're looking for medical coders, health information professionals, revenue cycle technicians, that kind of thing, medical records technicians, all of these different job titles for medical coders, because we are called lots of different things. And so just hearing, oh, it's too saturated. Here's the thing when people says, well, is the market too saturated? So right now is graduation season. A lot of students are completing their program, and a lot of these programs are, okay, they're going to cycle into the next term, either at the beginning of next month, which is in June. Some of them is going to be in August, towards the fall, the beginning, of the next cycle of program, and then it starts all over again. So right now there's a bunch of them, okay? So there's a bunch of graduates out there, and they're all looking for medical coding jobs. You'll see them all over LinkedIn where they'll say, oh, well, I would like to connect with you if you are in the medical coding field, and, I want to see if there's any opportunity. If you hear anything, let me know. That's just such a form response. I don't like seeing that. I think it looks, because everybody does that. I just don't think that it looks appealing to me, okay? And it also doesn't look appealing when people are getting frustrated and they're voicing their frustrations on the on LinkedIn and saying, oh, well, why won't anybody give me a chance? These are your future coworkers, as I've said, and you don't want to get a reputation of being a complainer right out of the gate, okay? I've blocked quite a few people because that's all they did was complain. They applied a few places and they start complaining. Well, Blue, they're just venting, okay? But there's a time and a place to vent, not on a professional website where you're going to be around other colleagues, because then they're going to see you complaining, okay? And you don't want that. But that's what you do, when you are out there and you are doing your own research and you are proactively out there. You're not applying for these places that are promising sign-on bonuses, things like that, because those are for people who have experience. But if you are signing up for these or applying for these places that they say, oh, well, 100% remote, again, you're setting yourself up for failure, because this is for people who've had experience. Yes, there are some new people that get in to working remotely, but it doesn't necessarily mean that it's a good thing, okay? When people work remotely, it's because they've had experience. If you do not have experience, you are going to miss out on a lot of really good things to learn when you are around other medical coders, okay? So just make sure that when you first start, that you are applying at your local hospitals, okay? Every city and town has a medical center. And when they have this medical center, you go there to the hospital or whatever, and you find out, how do you apply online? You look online, right? And you look for their job listings. If they say, well, our coders are handled by a third-party vendor who takes care of our coding, find out who that third-party vendor is and apply directly with them, okay? There's no need to be out here trying to get involved with all of these remote companies and things when you don't have experience. You need to work in person first, at least just to get an idea and a feel for it. Because doing that is going to set you up for success much better than if you are just, going out there and just applying, just trying to get into remote. But when, as I was saying earlier, when the market gets all these people saying, hey, I'm brand new, guess what happens to a lot of these people? Let's just say, for scale's sake, you have 100 people who graduated in the area, okay? Everybody's looking for a job, okay? Of these 100 people, they will apply for, let's say, 20 jobs, okay? Now, 50 of these people are going to say, well, I didn't hear anything, and I'm so frustrated, and I give up, okay? That's what happens that quickly, okay? They will give up, and they will be like, oh, this was just a waste of time and money, and everybody wants experience. Meanwhile, not doing their homework and not making sure their resume looks good, not applying everywhere when they should be applying everywhere, and applying at those positions that are even still asking for experience. Because if they're looking for a coder and they have not gotten a response and no one is applying, but you had the audacity to apply, well, now they're going to look at you and your resume. And if it's good enough, they're going to call you in. If not, they don't even know who you are. Okay. So we are down to 50. All right. And of these 50, and they're looking at the resume, a lot of these 50, 25 of these 50 have a 4 or 5 page resume. So we're going to get rid of those because they're never going to get the second call, because again, no one has time to flip through 4 or 5 pages of resume, which is ridiculous, because if you're brand new, it should only be on 1 page. Okay. So we're down to 25. So we have 25 people out of 100 that are actively still looking for a job, because even though they're getting rejections and even though they're having people tell them no, they're still out there insisting on applying and then insisting on trying to get in someplace. Okay. Now, out of these 25, you've got 15 that are applying everywhere, and they're also listening to me when I say to apply for the coding adjacent positions, like applying for medical biller, which will help you get some exposure to medical coding and things like that. Even though you are doing the billing, you sometimes will be correcting the codes. And if you're having to correct the codes, that's technically coding, okay? Because you have to look it up and make sure that you got the code right and look at the rules and things like that. So with that said, that's getting you coding experience without all the pressure of being a coder right away, because you're starting off in billing. Okay. So that's a good place to start. Medical claim reviewer for the insurance side. So for Aetna and Blue Cross Blue Shield and, all of these things, I do not recommend somebody else, but I'm just saying Aetna and Blue Cross Blue Shield, okay places to work for. So claims reviewer, okay? Which does not require you to have a medical coding certification, but you are getting and processing the claims that come in from the medical billers, right? And you're working for the insurance side. You're looking to see, you're going to run those codes through an encoder, right? An encoder is going to tell you if there's an edit. An edit means that there's something wrong with this claim. Either the code doesn't support, or something's not appropriate, or it's missing a modifier. And then it's either approved or denied. Okay. And then you either say yay or nay, and so that's what you do as a claim reviewer, claim processor. Sometimes it's called claim reviewer. Sometimes it's called claim processor, but look at the job listing. Cause sometimes when it says like a claim reviewer, they do that for like, if they're looking to get approved for a procedure. Okay. And they need like a medical professional to look over it. That's not what I'm telling you to do. I'm telling you to do the one that's saying about processing the claim, basically just putting everything in, make sure it's okay, and then sending the payment or denying it, and then saying why. Okay, that will also help you. Okay, so those 15 people that got that coding adjacent position are now out there gathering their experience, which leaves us to 10. We started with 100, and now we're down to 10. Okay, now we're down to 10 folks who are still at it. They are still looking, and they're adjusting their resume. They're making sure that their resume lines up with what they have skills wise versus what's in that job listing. And they're saying, okay, yes, I have this skill. Yes, I have this skill. And they're going to make their breakthrough. Sometimes it's 6 months in order to get in. Sometimes it's 8 months, but they finally do get in, and they finally get their job. So while there may be 100 graduates out there, only 10 of them will probably be the ones to get their first job. Because you have all of those people that quit, and all those people who give up, and all those people who go to alternative jobs that are still getting experience. And then you have that one little group that was stubborn enough to say, I'm going to find my first job, and they do. Because it is possible. It's just not going to happen as immediately as you think it is. There are exceptions, yes. Sometimes people get lucky and they've made connections right away, and they know somebody and they're able to get in. So those are the things that you have to know. As far as if this is for you or not, I have said several times that this is a wonderful career field to grow into. to learn. I am light years from where I started when I very first started in this career field. And I thought that this was a wonderful job when I first started it because it paid the bills and I was okay. And it wasn't until I was 6 years in that I finally had my aha moment. Now, people hear me talk about my aha moment. And then I will hear like new people, oh, I've had my aha moment and I just really love it. No, you're just infatuated right now. You haven't even gotten into it yet. When you start getting audits, when you start having to communicate with providers and send queries and do your first presentation and go through all of those and switching clinics and things, that's when you can come talk to me about having an aha moment and being passionate. Until then, you're just infatuated. And that's okay. It's great to start off that way because it gets you interested in wanting to learn more and improving yourself. And I'm not saying that it doesn't happen, but for a lot of people, it's just infatuation. You have to really grow into it in order for you to understand what I'm saying when I say that I had my aha moment. And, this is a career field that I love. Okay, so to recap, there is no program that I can recommend because I am not affiliated with these schools. Although I have said that if you're going to learn, you should learn directly from this school, from AHIMA or AAPC, not the school, but AHIMA or AAPC, because they both have their online programs. Okay, that who better to learn from it than the association themselves? Okay. I have also said you can learn on your own because I got so many people that were complaining because I had done the free syllabus, right? I had the videos up and everything, and people were just complaining and complaining and complaining. So I finally took it down. Okay. I don't want to do that. I don't like to do that. But at the same time, I just need the emails to stop with all the complaints. This is a free resource and you want to be ungrateful, whereas this resource has helped countless hundreds of people to pass their certification exams on their own and not have to go through all the worry of trying to go through a school and an expensive program and that kind of thing, and listening when I say, hey, here's your resources, or here's where you can find them for free. And yet I still get people, is this a waste of my time if I do this one in this chapter? And really? So I took it down. But I have wanted to do a facelift on the independent study syllabus. And I am working on it, and I will be putting it out for purchase later. Okay. Not right now, but I will be putting it out for purchase later. So that way it'll be a complete and comprehensive breakdown. All right. But I've always said that. And if you do a little research, you can figure it out. Okay. But until then, that's what I have to say about that. And having more education does not help. It does help to a certain extent, but it won't help set you apart, because you can have all the degrees that you want, but if you still cannot pass an assessment test, that's where the rubber meets the road. You've got to be able to pass the assessment test. If you cannot pass the assessment test, you will never get in. So degree or no degree, whatever, you will not get in if you cannot master the simple basics of coding, which is required through practice, which is required through reading the coding guidelines. As I've said, I've had people who say, is it a waste of my time to read the coding guidelines? No, but you're wasting my time with that silly question, because those are your rules. That's your rules. That's once you know those, and you don't have to memorize them, but you have to read them enough that you can say, wait a second, I know there's something about that. Okay. So you read them enough so that you know where to find the answer. Okay. Because no one expects you to memorize these, and they update every year. So that's just senseless to try to memorize. Okay. Save your bandwidth for that one. All right. So with that said, I'm going to go ahead and wrap this one up. Whatever choice you make, guys, this is a great career field. I have 1,400 videos where I talk about the ups and the downs, because that's any career field. But if you're willing to give it your all, and you're willing to get out there and do what you need to do and not get so discouraged right away, there's a wonderful reward in it for you in having a career field that you truly do love. I'm just saying. With that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.